Histamine. Now I know why I'm sick. The hidden mistakes that make you finally get out of hell now. It is a matter close to my heart to introduce you to the world of this book about histamine intolerance. As an author, I not only feel the need to convey scientific facts, but also to share my personal story, which gave rise to this project. For years I suffered in silence without understanding why my body reacted so vehemently to certain foods. A constant interplay of non-specific complaints and health challenges determined my everyday life and put a strain not only on me but also on my family. In a seemingly endless process of self-discovery, I finally came across the explanation for my complaints: histamine intolerance. This realization was not only liberating, but also the starting point for a journey to a healthier life. In dealing with this often underestimated metabolic disorder, I not only found answers, but also practical ways in which I and my family could achieve a better quality of life. In this book I would like to share my experiences, insights and, above all, my hope with you. It is not just intended to be a guide, but also a companion on the path to a more conscious approach to dealing with histamine intolerance. Together we will take a look at the basics, discuss practical tips for everyday life, and also give space to the emotional aspects. My hope is that this book not only informs, but also encourages and inspires. May it help you to stop suffering in secret and instead find your own path to a healthier and more fulfilling life. Strengthened and informed. Find your way. Introduction to histamine intolerance. The world of health is complex and individual. Often it is the quiet, invisible signals from our body that point to deeper causes. In this introduction we want to take a first look at one of these causes: histamine intolerance. Histamine, a messenger substance produced by the body, plays a crucial role in numerous biological processes. But what happens when our body cannot process this molecule in the usual way? What does it mean when the balance is disturbed and the body's reactions to certain foods or environmental factors become excessively intense? In this section, we will explore the basics of histamine intolerance, from the biochemical processes in the body to the diverse symptoms that can occur. We want to offer you a clear overview so that you can better understand the mechanisms behind this metabolic disorder and thus take a first step towards a targeted approach to your own health. Histamine intolerance is not only a challenge, but also an opportunity to get to know your own body better and give it the attention and care it deserves. Let's delve into this fascinating world together and take the first step towards a more conscious and healthier life. The importance of a comprehensive understanding. Histamine intolerance is more than just a list of foods to avoid. It is a complex interplay of biochemical processes, individual genetic factors, and environmental influences. A comprehensive understanding of this metabolic disorder is crucial to not only treat the symptoms, but also to understand and address the underlying causes. In this section, we will talk about why it is so important not to look at histamine intolerance in isolation, but to put it in a broader context. A holistic understanding allows individual differences and needs to be taken into account and opens up the way to personalized approaches in tackling this challenge. We will explore how a precise knowledge of one's own histamine intolerance can not only contribute to a targeted diet, but also to a more conscious lifestyle. This includes dealing with stress, taking environmental factors into account, and choosing suitable treatment approaches. A comprehensive understanding not only makes it possible to alleviate symptoms, but also to sustainably improve the quality of life. With this knowledge, you can become an active designer of your own health. With this in mind, we want to explore together the importance of a comprehensive understanding of histamine intolerance and lay the foundation for a holistic approach on your path to greater well-being and joy in life. Basics of histamine intolerance. Understanding the basics of histamine intolerance is key to managing this complex metabolic disorder. In this section, we will take a closer look at the biochemical processes involved in histamine intolerance, the causes and development, and discuss the diverse symptoms and diagnosis of this often underestimated condition. What is histamine? Histamine, a small molecule with great importance, plays a crucial role in numerous physiological processes in our body. In this section, we will take a closer look at the nature and functions of histamine to develop a comprehensive understanding of its role in the human organism. The biochemistry of histamine. Insight into the molecular structure. Histamine, chemically known as 2,4-imidazolyl ethylamine, belongs to the group of biogenic amines. Its molecular structure is simple, but its effects in the body are extremely diverse. Histamine is formed by the enzymatic decarboxylation of the amino acid histidine and is found mainly in mast cells, basophils and certain neurons. This molecule is not only present in our body, but also in many foods, especially fermented products such as cheese and wine. The role of histamine in the body. A multifunctional molecule. Histamine is not just a substance that triggers allergic reactions. On the contrary, it fulfills a variety of vital functions. One of its main tasks is to regulate the gastrointestinal system, in particular to control the production of stomach acid. This also explains why people with histamine intolerance often suffer from gastrointestinal complaints. Furthermore, histamine is a central player in the immune system. It is released during infections or allergic reactions to initiate an inflammatory response in the body. It influences the permeability of blood vessels to transport immune cells more effectively to the affected areas. This function, which is life-saving in a healthy context, can, however, lead to undesirable side effects in cases of histamine intolerance. Another aspect of histamine's effect is its influence on the central nervous system. Histamine is a neurotransmitter that is involved in the regulation of sleep-wake cycles, attention and emotional stability. It plays a crucial role in controlling the hypothalamic-pituitary-adrenal axis, which in turn influences stress hormone levels. Histamine in everyday life. Sources and challenges. In addition to its role in the body, we also absorb histamine through food. Foods such as aged cheese, red wine, fermented products and certain types of fish often contain high amounts of histamine. For people with intact histamine degradation, this is usually not a problem, but for those with histamine intolerance, consuming histamine-rich foods can lead to unpleasant symptoms. However, histamine is not only present in food, it is also produced by certain bacteria during the fermentation of food. Therefore, even seemingly healthy foods such as sauerkraut or yogurt can be problematic for people with histamine intolerance. Disorders in histamine metabolism. Causes and effects. The causes of histamine intolerance are varied and often complex. One of the most common causes is a deficiency or malfunction of the enzyme diamine oxidase, DAO, which is responsible for breaking down histamine in the intestine. A genetic predisposition may also play a role, as some people produce less efficient DAO enzymes due to their genetic predisposition. The effects of disturbed histamine metabolism processes can be far-reaching. In addition to the gastrointestinal complaints, allergy symptoms and sleep disorders already mentioned, headaches, dizziness and muscle pain can also occur. The multitude of symptoms does not always make diagnosis easy and often requires a careful examination by qualified specialists. Conclusion: histamine as the key to health. Histamine is a fascinating molecule whose significance in the human body goes far beyond allergic reactions. Its functions extend from the immune system and nervous system to gastrointestinal regulation. But for people with histamine intolerance, this otherwise vital substance can become a burden. A deeper understanding of histamine, its sources and the complex metabolic process enables those affected to deal with their intolerance in a more targeted manner. A conscious diet and a healthy lifestyle can alleviate symptoms and sustainably improve quality of life. Histamine is not only the trigger for symptoms, but also the key to a comprehensive understanding of one's own health. Histamine metabolism in the body. Histamine metabolism is a complex biochemical process that significantly influences the regulation of histamine in the organism. The smooth running of this metabolic pathway is crucial for the balance of histamine concentration in the body and thus for well-being. In this section, we take a detailed look at the different phases of histamine metabolism and shed light on how disturbances in this process can lead to the development of histamine intolerance. Biosynthesis of histamine. Formation of the messenger substance. The biosynthesis of histamine begins with the amino acid histidine, which is present in various foods and can also be synthesized in the human body. The enzyme histidine decarboxylase catalyzes the decarboxylation of histidine to histamine. This process occurs primarily in mast cells, basophils and certain nerve cells. The formed histamine molecules can be stored in vesicles within the cells until they are released by various stimuli. Triggers include allergens, immune reactions, stress and other stimuli that led to the mobilization of histamine from storage cells. Receptors and effects of histamine. Regulation of physiology. Histamine exerts its effects by binding to specific receptors. There are four main types of histamine receptors, H1 to H4, found in various tissues and cells in the body. Each receptor type mediates different physiological effects. H1 receptors. These are found mainly on smooth muscle cells and endothelial cells. Their stimulation leads to smooth muscle contractions, increased permeability of capillaries and thus to allergic reactions and inflammation. H2 receptors. These are found mainly on cells of the gastric mucosa. Their activation stimulates the production of gastric acid and is therefore significantly involved in the regulation of gastrointestinal function. H3 receptors. These are found primarily in the central nervous system and modulate the release of neurotransmitters, particularly histamine itself. They play a role in regulating sleep-wake cycles and attention. H4 receptors. These are mainly present on cells of the immune system and influence inflammatory processes and the recruitment of immune cells. Histamine degradation. The key to balance. Efficient histamine degradation is crucial to prevent excessive histamine concentration in the body. This degradation is mainly carried out by the enzyme diamine oxidase, DAO, which is found in various tissues, especially in the intestine. DAO breaks down histamine inactivating molecules, which can then be excreted. People with histamine intolerance often have a lack of functioning DHEA or a disturbed breakdown of histamine. This increases the histamine concentration in the blood, which can lead to the characteristic symptoms of the intolerance. Disturbances in histamine metabolism. Causes of histamine intolerance. Histamine intolerance can arise in various ways. A genetic defect that leads to a deficiency of DHEA is a common cause. The enzyme is not produced sufficiently or its functionality is impaired. In addition, certain medications, such as DHEA-inhibiting substances, can hinder the breakdown of histamine and thus lead to an imbalance. Another aspect is the regulation of the H1 receptors. An excessive response of these receptors can lead to increased allergic reactions, which are often pronounced in cases of histamine intolerance. Summary: the balance in histamine metabolism. Histamine metabolism is a highly regulated process that influences the physiological balance in the body. Precise regulation of synthesis, release and degradation is essential to prevent undesirable symptoms. In the case of histamine intolerance, this finely tuned mechanism becomes unbalanced, which can lead to the organism being overloaded with histamine. A deep understanding of these processes forms the basis for the development of targeted therapy approaches and an individually adapted lifestyle for those affected. Causes and development of histamine intolerance. Histamine intolerance is a complex metabolic disorder, the causes of which are varied and often vary from individual to individual. In this section, we will take a closer look at the various factors that can contribute to the development of histamine intolerance. From genetic aspects to environmental factors, we will look at the various influences that can cause the body to have difficulty processing histamine effectively. Genetic predisposition. A look at the DNA. Genetic factors play an important role in the development of histamine intolerance. There is evidence that certain genetic variants can affect the production of enzymes that are crucial for the breakdown of histamine. In particular, mutations in the DHEA gene, which is responsible for the production of diamine oxidase, DHEA, can lead to a deficiency in this crucial enzyme. People who genetically produce less DHEA often have difficulty breaking down histamine effectively. A deficiency of diamine oxidase, DHEA, is one of the main causes of histamine intolerance. DHEA is the enzyme that breaks down histamine in the intestine and thus prevents its excessive accumulation in the blood. Various factors can lead to a deficiency of DHEA. These include genetic predispositions, but also diseases of the digestive tract that can affect the production or activity of this enzyme. In addition, certain medications, such as DHEA-inhibiting substances, can hinder the breakdown of histamine and thus increase the symptoms of histamine intolerance. A comprehensive medication list, drawn up in consultation with a doctor, is therefore of great importance for people with histamine intolerance. Increased histamine production, a vicious circle. Increased production of histamine in the body can also contribute to histamine intolerance. This can be caused by an increased release of histamine in the mast cells and basophils, triggered by allergens, stress or inflammatory processes. The increased production overloads the histamine breakdown, especially when DHEA is not available in sufficient quantities. Intestinal health. A key influencing factor. The health of the digestive tract plays a crucial role in the development of histamine intolerance. A damaged intestine, for example due to inflammation, infection or the presence of certain bacteria, can impair the production and activity of DAO. A disturbed intestinal flora can also lead to an increased production of histamine. In addition, intestinal health can be negatively affected by the use of antibiotics, which disrupt the natural intestinal flora. A holistic approach to treating histamine intolerance therefore often includes measures to promote healthy intestinal flora. Summary: complex causes of histamine intolerance. Histamine intolerance is not a disease with a clear cause, but the result of a complex interaction of genetic, enzymatic, immunological and environmental factors. A deep understanding of the causes makes it possible to develop targeted measures to alleviate the symptoms. The individual nature of the development of histamine intolerance also underlines the need for a personalized approach in diagnosis and therapy. In the next sections, we will look at other aspects of histamine intolerance in order to obtain a comprehensive picture of this metabolic disorder. Symptoms and diagnosis. The symptoms of histamine intolerance can be varied and often non-specific, which can make diagnosis difficult. In this section, we will look in detail at the typical signs of histamine intolerance and then examine various methods for diagnosing this metabolic disorder. Symptoms of histamine intolerance. A wide spectrum. Histamine intolerance manifests itself through a wide range of symptoms that can range from mild discomfort to more serious health problems. The most common symptoms include gastrointestinal complaints, abdominal pain, flatulence, diarrhea or constipation are common symptoms because histamine has a strong influence on gastrointestinal function. Headaches and migraines. Some people with histamine intolerance report frequent headaches or migraine attacks in response to histamine-rich foods. Skin problems, itching, skin redness, hives, urticaria, and eczema may occur because histamine plays a role in the skin reaction. Respiratory problems. Histamine can affect the respiratory system and cause symptoms such as coughing, shortness of breath and asthma. Cardiovascular problems. Some people with histamine intolerance report heart palpitations, blood pressure fluctuations and dizziness. Psychological symptoms. Histamine can affect the central nervous system and lead to irritability, sleep disorders, anxiety and depression. Diagnosis of histamine intolerance. Challenges and approaches. Diagnosing histamine intolerance can be challenging because many of the symptoms are non-specific and can also occur in other diseases. A thorough analysis in which the doctor collects the patient's medical history is an important first step. Attention should be paid to possible triggers, temporal connections with food intake and family history, exclusion of other causes, differential diagnosis. It is crucial to rule out other possible causes of symptoms before making a diagnosis of histamine intolerance. These include food allergies, inflammatory bowel disease, gastrointestinal infections and other gastrointestinal disorders. Food diary and provocation tests. Identification of triggers. A food diary can help to identify connections between the foods consumed and the symptoms that occur. Provocation tests, in which histamine-rich foods are gradually reintroduced into the diet, can also be used to test individual histamine tolerance. However, this should be done under medical supervision to control for possible allergic reactions. Blood tests and DAO measurements. Objectification of the diagnosis. Blood tests can indicate elevated histamine concentrations, but are often not conclusive on their own, as the histamine level in the blood can fluctuate. Measuring DAO activity in the blood can also help to detect a deficiency of this enzyme. Outlook and personal experience. A holistic approach. Diagnosing histamine intolerance often requires a holistic approach that combines different methods. An experienced doctor, preferably a gastroenterologist or allergist, can provide crucial support in making the diagnosis and developing an individual treatment plan. Understanding and managing histamine intolerance requires not only medical expertise, but also the willingness of the individual to observe their body closely and listen to its signals. A collaborative dialogue between patient and doctor is the key to successfully overcoming this metabolic disorder. In the following sections, we will take a closer look at treatment approaches and how to deal with histamine intolerance on a daily basis. Diet for histamine intolerance. Diet plays a central role in the management of histamine intolerance. In this section, we will look in detail at the basic principles of a low histamine diet, from histamine-rich foods to recommendations for a balanced yet enjoyable diet. We offer a comprehensive insight into the challenges and opportunities in designing a meal plan for people with histamine intolerance. 3.1 Histamine-rich foods. What should be avoided? A low histamine diet requires avoiding or at least reducing foods rich in histamine. These include in particular, fermented foods, sauerkraut, soy sauce, vinegar, ripe foods, ripe cheese, ripe fruits, smoked or air-dried foods, smoked fish, air-dried ham, preserved foods, pickled vegetables, canned goods, alcoholic beverages, red wine, champagne, beer. 3.2 Low histamine alternatives. Variety despite limitations. Despite the limitations, there are many low histamine alternatives that allow for enjoyable meals. These include fresh food, fresh meat, fish, eggs, fresh vegetables and fruit, dairy products, fresh milk, butter, young cheeses, cereal products, rice, pasta, bread made from fresh flour, herbs and spices, fresh herbs such as parsley, basil, dill. Proper food preparation, such as cooking fresh ingredients, can also help reduce histamine exposure. 3.3 Biogenic amines and histamine liberators. Consider other factors. In addition to histamine, other biogenic amines such as tyramine and putrescine are also relevant for people with histamine intolerance. Tyramine is found in foods such as chocolate, coffee and some nuts. Histamine liberators, which promote the release of histamine from cells, should also be considered. These include certain food additives, strawberries, tomatoes and some spices. 3.4 Individualization of nutrition. Every person is unique. The effects of foods can vary from individual to individual, and not everyone with histamine intolerance reacts to the same foods in the same way. A food diary can help identify individual triggers and better understand the tolerance of certain foods. A gradual reintroduction of foods under medical supervision can also help identify well-tolerated options. 3.5 Tips for everyday life. Shopping, cooking and eating out. Shopping and cooking with histamine intolerance requires a certain amount of planning and attention. Reading food labels, using fresh ingredients and avoiding processed foods are important measures. When eating out, it is advisable to inform the staff about your special dietary needs and, if possible, consult them in advance. 3.6 Ensure nutrient supply. Supplements when needed. A diet low in histamine can lead to certain nutrients being absorbed in smaller quantities. If necessary, dietary supplements can be a useful addition in consultation with a doctor to ensure a balanced supply. Summary: a balanced food selection for histamine intolerance. Diet for histamine intolerance requires careful selection of foods and individual adaptation. Despite the limitations, it is possible to create a varied and enjoyable diet. Advice from a nutritionist or doctor who specializes in histamine intolerance can help ensure a balanced diet and meets individual needs. In the following sections, we will look at other aspects of managing histamine intolerance, including lifestyle factors, treatment approaches and emotional support. 100 foods with little to no histamine. Fresh meat, chicken, turkey, beef, fresh fish, cod, pick-a-perch, trout, fresh seafood, shrimps, mussels, eggs, fresh vegetables, spinach, broccoli, carrots, fresh fruit, apples, pears, peaches, rice, potatoes, corn, quinoa, millet, buckwheat, oatmeal, fresh herbs, parsley, basil, chives, fresh ginger, fresh garlic, fresh onions, fresh celery, fresh green peppers, fresh cucumbers, fresh carrots, fresh zucchini, fresh cauliflower, fresh asparagus, fresh avocado, fresh salad, fresh radishes, fresh leek, fresh pumpkin, fresh eggplant, fresh beetroot, fresh parsnips, fresh artichokes, fresh peas, fresh green beans, fresh broccoli, fresh leaf spinach, fresh charred leaves, fresh lollo rosso salad, fresh lettuce, fresh endive, fresh chicory, fresh arugula, fresh spring onions, fresh fennel bulb, fresh Chinese cabbage, fresh kohlrabi, fresh white cabbage, fresh red cabbage, fresh Savoy cabbage, fresh lamb's lettuce, fresh radicchio, fresh parsley root, fresh turnips, fresh white radish, fresh mung bean sprouts, fresh alfalfa sprouts, fresh broccoli sprouts, fresh radish sprouts, fresh lentil sprouts, fresh cress, fresh kale leaves, fresh chard, fresh leek, fresh romaine lettuce, fresh oak leaf lettuce, fresh radicchio leaves, fresh chicory, fresh sweet corn, fresh watercress, fresh beetroot leaves, fresh bok choy, fresh watercress, fresh purple carrots, fresh salsify, fresh yellow beets, fresh turnips, fresh Hokkaido pumpkins, fresh butternut squash, fresh nutmeg pumpkins, fresh delicatessen pumpkins, fresh acorn pumpkins, fresh patty pan squash, fresh spaghetti squash, fresh sweet dumpling pumpkins, fresh green peppers, fresh yellow peppers, fresh red peppers, fresh orange peppers, fresh white peppers, fresh purple peppers, fresh brown peppers, fresh yellow zucchini, fresh green zucchini, fresh white zucchini. 20 low histamine side dishes. Here are 20 side dishes that are often considered low in histamine. However, keep in mind that individual tolerances may vary and it is wise to pay attention to your own reactions. Steamed vegetables, broccoli, carrots, cauliflower, zucchini, mashed potatoes, potatoes unprocessed, butter or lactose-free milk, rice, white or brown rice varieties, quinoa salad, quinoa, cucumbers, tomatoes, in moderation and depending on tolerance, fresh herbs, such as parsley, baked pumpkin, butternut squash, olive oil, rosemary, cucumber salad, fresh cucumbers, vinegar, if tolerated, fresh dill, root vegetable mash, parsnips, celery root, potatoes, grilled eggplant, eggplants, olive oil, garlic, optional, lettuce, lamb's lettuce, arugula, steamed artichoke hearts, canned or fresh, olive oil, lemon juice, cabbage rolls with minced meat filling, white cabbage leaves, lean ground meat, rice, if tolerated, garlic-free pesto, basil, pine nuts, olive oil, Parmesan cheese, if tolerated, baked asparagus, olive oil, lemon juice, fresh avocado tomato salad, avocado, tomatoes, if tolerated, fresh coriander leaves, zucchini noodles, zucchini, olive oil, fresh basil, watermelon feta salad, watermelon, feta cheese, if tolerated, fresh mint, grilled mushrooms, olive oil, rosemary, steamed green asparagus, lemon juice, olive oil, steamed chard leaves, olive oil, onions, tomato-free guacamole, avocado, onions, garlic, if tolerated, lime juice. These side dishes can be a varied and tasty addition to low histamine main dishes. As always, it is important to pay attention to individual reactions and make adjustments if necessary. If in doubt, it is advisable to consult a healthcare provider or nutritionist. Low histamine meat, turkey, fresh turkey meat, beef, lean beef, such as fillet or lean ground beef, lamb, lean lamb meat, pork, lean pork, especially fillet or loin, veal, lean veal, wild, fresh game meat, such as deer or roe deer. It is important to note that the freshness of the meat can play a role. Fresh meat that has not been stored for long usually contains less histamine than processed or stored meat. In addition, the cooking method and storage factors can affect the histamine content. When buying meat, it is advisable to pay attention to freshness and consider processing and storage methods. It can also be helpful to choose meat products without additives to minimize the risk of histamine-releasing substances. As with all aspects of a low histamine diet, it is important to consider individual tolerance and seek advice from a healthcare provider or nutritionist if necessary. Fruit histamine arm. Low histamine fruits can be a good choice for people with histamine intolerance. Here are many examples of fruits that are considered low histamine. Apples. Green apples are often better tolerated than ripe varieties. Pears. All pear varieties. Peaches. Fresh peaches, not too ripe. Nectarines. Fresh nectarines. Melons. Watermelon. Honeydew melon. Mango. Fresh mango. Cherries. Sweet cherries are often better tolerated than sour cherries. Strawberries. Fresh strawberries. Blueberries. Fresh blueberries. Blueberries. Fresh blueberries. Raspberries. Fresh raspberries. Blackberries. Fresh blackberries. Pineapple. Fresh pineapple. Citrus fruits. Lemons, in moderation and depending on tolerance. Limes. Oranges. Papaya. Fresh papaya. Pomegranate. Fresh pomegranate. Plums. Sweet plums, not too ripe. Apricots. Fresh apricots. Cantaloupe melon. Fresh cantaloupe melon. It is important to note that individual tolerances may vary, and it is recommended that reactions to certain types of fruit be monitored individually. The fruit should be as fresh as possible and not overripe, as the histamine content in overripe fruit can increase. If there is any uncertainty, it is advisable to consult a nutritionist or doctor. Grain and gluten-free alternatives. If you have histamine intolerance, it is important to not only choose foods that are low in histamine, but also to consider gluten-free options. Here are grain and gluten-free alternatives that can be considered in a low histamine diet. Rice. Rice is gluten-free and a versatile side dish or main course. Quinoa. This gluten-free pseudo-cereal is rich in protein and fiber. Millet. Millet is a good gluten-free source of carbohydrates and minerals. Buckwheat. Despite its name, buckwheat is gluten-free and can be used as an alternative to grains. Corn flour. Corn flour is good for gluten-free baked goods and as a thickener. Potatoes. Potatoes are a gluten-free source of carbohydrates and can be prepared in many different ways. Sweet potatoes. These offer a gluten-free alternative to traditional potatoes and are rich in antioxidants. Tapioca. Tapioca is a starchy, gluten-free product that can be used as a thickener. Amaranth. Amaranth is gluten-free and rich in protein and minerals. Chestnut flour. This flour made from chestnuts is a gluten-free alternative for baking purposes. Chickpea flour. Chickpea flour is a high-protein, gluten-free option for various dishes. Coconut flour. Coconut flour is gluten-free and can be used in gluten-free baking recipes. Lentil flour. Lentil flour is a protein-rich gluten-free alternative. Corn semolina. Corn semolina is good for making polenta and is gluten-free. Gluten-free oats. Oats themselves do not contain gluten, but it is important to choose gluten-free oats to avoid contamination. When choosing gluten-free alternatives, it is advisable to pay attention to the quality of the products and consciously choose natural, unprocessed options. This can not only support the gluten-free diet, but also contribute to an overall healthier lifestyle. Histamine-rich foods and how to avoid them. Histamine-rich foods and their avoidance are crucial for people with histamine intolerance to minimize symptoms. Here is a list of histamine-rich foods that should be avoided or limited. Smoked and air-dried foods. Smoked ham. Smoked fish. Salmon. Mackerel. Air-dried ham. Salami. Sausages. Fermented foods. Sauerkraut. Kimchi. Soy sauce. Miso. Vinegar. Ripe foods. Mature cheese. Parmesan. Gouda. Camembert. Ripe fruits: banana. Strawberries. Raspberries. Ripe tomatoes. Preserved foods. Pickled vegetables. Canned food: tuna. Sardines. Ready-made sauces. Alcoholic beverages. Red wine. White wine. Beer. Champagne. Schnapps. Foods with histamine liberators. Tomatoes. Eggplants. Spinach. Strawberries. Pineapple. Avocado. Kiwi. Food additives. Artificial preservatives. Dyes. Flavors. Finished products. Ready meals. Canned soups. Instant noodles. Fast food. Yeast and yeast products. Fresh yeast. Baking powder. Yeast containing baked goods. Spices. Cinnamon. Paprika. Nutmeg. Cayenne pepper. Cloves. It is important to note that individual reactions to histamine-rich foods can vary. A food diary can help identify specific triggers. Proper food storage is also important, as long storage times and improper storage can lead to an increase in histamine levels. It is recommended to work with a nutritionist or doctor to develop an individualized nutritional strategy and ensure that all nutritional needs are met. Cooking and preparation tips for histamine-low meals. Preparing low histamine meals requires care and creativity to ensure enjoyment despite restrictions. Here are some cooking and preparation tips for low histamine meals. Use fresh ingredients. Focus on fresh meat, fish, fruit and vegetables. Avoid processed and preserved foods. Pay attention to the preparation method. Cook foods instead of frying or grilling them to minimize histamine formation. Steam cooking is a gentle method that keeps the histamine content low. Use fresh herbs and spices. Use fresh herbs such as parsley, basil, chives, which are generally low in histamine. Spices such as fresh ginger and garlic can be tasty alternatives. Pay attention to the quality of the food. Buy high quality, fresh and seasonal food. Pay attention to the origin of meat and fish. Use low histamine oils. Use olive oil, which is usually low in histamine. Avoid oily sauces and dressings. Choose low histamine carbohydrate sources. Rice, potatoes, quinoa and buckwheat are good low histamine options. Avoid grain products containing gluten if gluten intolerance aggravates symptoms. Pay attention to freshness of dairy products. Fresh dairy products such as fresh milk, butter and young cheeses are usually better tolerated. Low histamine substitute products. Learn more about low histamine alternatives to typical foods, such as low histamine fish or cheese varieties. Be careful when using leftovers. Histamine levels can increase over time, especially in foods that have not been stored correctly. Avoid using reheated leftovers if possible. Keep a food diary. Make note of which foods are well tolerated and which ones trigger symptoms. A food diary helps to identify individual tolerances and triggers. Use special products. There are special low histamine food products on the market that can help with preparation. Pay attention to the ingredients and quality of the products. Unleash creativity in the kitchen. Try new recipes and ingredients to create variety. Experiment with spices and herbs to intensify the flavor. It is important to emphasize that individual tolerances may vary. It is recommended to work closely with a nutritionist or doctor to develop a nutritional strategy tailored to individual needs. Importance of dietary supplements. Dietary supplements play an important role in supplementing certain nutrients or compensating for deficiencies. Here are some of the main reasons and importance of dietary supplements. Compensation for nutrient deficiencies. Dietary supplements are often taken to correct deficiencies in certain nutrients that may arise from an unbalanced diet or other factors. Support for special phases of life. During certain phases of life, such as pregnancy, breastfeeding or old age, the need for certain nutrients may be increased. Dietary supplements can help meet these increased requirements. Sports performance and recovery. Athletes and people who regularly engage in intense exercise may have increased needs for certain nutrients. Dietary supplements can help support the body during intense activity and promote recovery. Prevention of deficiency symptoms. In regions where certain nutrients are less available in foods or are restricted by certain diets, dietary supplements can help prevent deficiencies. Support for specific health conditions. Certain health conditions or diseases can lead to an increased need for certain nutrients. Dietary supplements can serve as a supportive measure in such cases. Vitamin D in winter. In regions with little sunlight during the winter, the body's own production of vitamin D can be impaired. Vitamin D supplements are often recommended in these cases. Vegetarians and vegans. People who follow a vegetarian or vegan diet may have a harder time absorbing certain nutrients such as vitamin B12, iron and omega-3 fatty acids in sufficient quantities from plant sources. This is where dietary supplements can be helpful. Healthy aging. As we age, nutrient absorption and utilization may be impaired. Dietary supplements can help older people meet their nutritional needs. Lifestyle and histamine intolerance. Lifestyle plays an important role in managing histamine intolerance. Here are some lifestyle aspects that should be considered for people with histamine intolerance. Nutrition. Low histamine diet. Choosing low histamine foods and avoiding foods high in histamine is crucial. This also includes taking individual tolerances and trigger foods into account. Fresh preparation. Fresh preparation of meals can help control histamine levels. Processed and long-stored foods should be avoided. Small, frequent meals. Instead of large meals, smaller, more frequent meals can help reduce histamine exposure. Storage and preparation of food. Store food correctly. Foods rich in histamine should be stored correctly to minimize histamine formation. Refrigeration and quick freezing can be helpful. Buy fresh. When shopping, pay attention to fresh food and critically examine packaged or pre-processed products. Stress management. Avoid stress. Stress can release histamine-like substances and worsen symptoms. Stress management techniques such as meditation, yoga or breathing exercises can help. Sufficient sleep. A regular sleep cycle and sufficient sleep are important for general well-being and can also influence histamine-related symptoms. Physical activity. Moderate exercise. Regular, moderate physical activity can strengthen the immune system and promote overall health. Adjust your exertion. Intense physical exertion can impair histamine breakdown. Adjusting your training intensity is advisable. Dietary supplements. Take as needed. Dietary supplements can help correct certain nutritional deficiencies, but this should be done in consultation with a doctor or nutritionist. Consideration of individual triggers. Keep a food diary. A food diary can help identify individual trigger foods and better understand the progression of histamine intolerance. Medication management. Avoiding certain medications. Some medications can affect histamine breakdown. Alternative medications should be considered in consultation with a doctor. Regular medical checkups. Specialist care. Regular visits to a gastroenterologist, allergist or nutritionist can help monitor the progression of histamine intolerance and adjust treatment. Lifestyle adjustments are crucial for effectively managing histamine intolerance. Individual differences should be taken into account and close cooperation with professionals can help develop an appropriate lifestyle. Stress management and its effects. Definition of stress. Stress is the body's natural reaction to pressure and challenges. It can be physical, emotional or psychological. Effects of stress. Physical effects. Increased blood pressure, accelerated heartbeat, muscle tension, digestive problems, reduced immune function. Emotional effects. Fear, irritability, depression, sleep disorders, concentration problems. Psychological effects. Changes in thinking and perception. increased irritability, reduced stress management skills, stress management techniques, relaxation techniques, meditation, progressive muscle relaxation, breathing exercises, yoga, exercise and sport. Regular physical activity promotes the release of endorphins, the so-called happiness hormones. Healthy eating. A balanced diet not only supports physical health but also emotional well-being. Social support. Talking to friends, family or therapists can help reduce stress and clarify perspectives. Time management. Effective time management helps to minimize overload and thus stress. Hobbies and interests. Make time for personal hobbies and interests to experience joy and relaxation. Sleep hygiene. Adequate and high-quality sleep is crucial for managing stress. Long-term effects of unmanaged stress. Mental health. Chronic stress can increase the risk of mental illnesses such as depression and anxiety. Physical health. Long-term stress is associated with an increased susceptibility to cardiovascular disease, diabetes and other health problems. Immune system. A weakened immune system can lead to more frequent illnesses. Long-term changes in the brain. Chronic stress can affect the structure and function of the brain, particularly the areas responsible for emotions and decision-making. 5. Importance of stress management. Effective stress management helps minimize the negative effects of stress and improve overall quality of life. It promotes emotional resilience, the ability to deal with challenges, and supports well-being on a physical and psychological level. Professional help. In case of persistent or particularly stressful stress, it is advisable to seek professional help, such as from psychologists, psychotherapists or stress management experts. The importance of stress management is to minimize the negative effects of stress and promote a healthy lifestyle. It is an essential component for overall well-being and the prevention of long-term health problems. Exercise and sports. Physical health. Cardiovascular system. Regular physical activity strengthens the heart and improves blood circulation, which reduces the risk of cardiovascular disease. Weight management. Exercise helps control body weight by increasing calorie consumption and promoting fat burning, strengthening the musculoskeletal system. Physical activity promotes muscle development and strengthens bones, joints and the spine. Blood pressure regulation. Regular exercise can help regulate blood pressure and reduce the risk of high blood pressure. Mental health. Mood improvement. Physical activity leads to the release of endorphins, the so-called happiness hormones, which can improve mood. Stress relief. Exercise has a stress-reducing effect because it reduces the release of stress hormones and promotes relaxation. Sleep quality. Regular exercise can contribute to better sleep and reduce sleep disorders. Anxiety and depression prevention. There is evidence that physical activity can help prevent anxiety and depression. Social aspects. Sense of community. Sports activities in groups promote social interactions and strengthen the sense of community. Teamwork. Team sports promote teamwork, cohesion and the exchange of social experiences, improving the quality of life. Energy and vitality. Physical activity helps increase energy and vitality, which improves the quality of life. Better coping skills. Through sporting challenges, coping skills can be strengthened and self-confidence can be built. Improved cognitive functions. There is evidence that exercise promotes cognitive function and can reduce the risk of cognitive diseases. Disease prevention. Prevention of chronic diseases. Regular exercise helps prevent numerous chronic diseases such as diabetes, osteoporosis, and certain types of cancer. Immune system strengthening. Physical activity can strengthen the immune system and reduce susceptibility to infections. Recommendations for physical activity. The World Health Organization, WHO, recommends at least 150 minutes of moderate aerobic exercise per week or 75 minutes of vigorous aerobic exercise combined with muscle strengthening exercise on 2 or more days. It is important to choose an activity that matches your interests to maintain motivation. Before starting a new exercise program, it is advisable to have a medical examination, especially if you already have health concerns. Exercise and sport are of central importance for health and well-being. Regular physical activity can have a positive impact on many aspects of physical and mental health and reduce the risk of various diseases. Sleeping habits. Regular sleep-wake rhythm. A regular sleep-wake rhythm helps to stabilize the body's biological clock. Fixed bedtimes and wake-up times help to improve the quality of sleep. Sleeping environment. A pleasant sleeping environment promotes restful sleep. This includes a comfortable mattress and pillows. Blackout options. A pleasant room temperature and low noise levels. Relaxation rituals. Relaxation rituals before bedtime, such as reading, meditating, or taking a warm bath, help the body prepare for sleep. Avoiding stimulants. Caffeinated drinks, electronic devices, and exciting activities should be avoided a few hours before bedtime to avoid disrupting sleep. Regular physical activity. Regular exercise not only contributes to physical health, but can also improve sleep quality. However, intense physical activity should be avoided shortly before bedtime. Healthy eating. A balanced diet not only supports physical health, but can also affect sleep. Heavy meals before bedtime should be avoided. Alcohol and nicotine. Alcohol and nicotine can disrupt sleep. Consumption should therefore be limited before going to bed. Technology-free zone. The bedroom should be a technology-free zone. Using electronic devices, such as smartphones or tablets, before bedtime can affect sleep quality. Stress management. Stress can negatively affect sleep. Stress management techniques, such as meditation or breathing exercises, can help calm the mind and ease the transition to sleep. Sleep hygiene for sleep disorders. People with sleep disorders should take a closer look at their sleeping habits and seek professional help if necessary. Sleep experts can provide recommendations for improving sleep hygiene. Plan enough sleep time. Adults should generally aim for 7-9 hours of sleep per night. Individual sleep needs can vary, so it's important to allow enough time for adequate sleep. Regular medical examinations. If you have persistent sleep problems or suspect you have a sleep disorder, you should consult a doctor. Professional help can help identify the causes of sleep problems and take appropriate measures. Healthy sleep habits are crucial for physical and mental well-being. By practicing good sleep hygiene, you can increase your chances of getting a restful night's sleep and improve your overall health. Influence of environmental factors. Air quality. Positive influence. Fresh and clean air promotes respiratory health and can reduce the risk of respiratory problems. Negative impact. Air pollution, especially from pollutants such as fine dust and pollutant gases, can lead to respiratory problems, cardiovascular diseases and other health problems. Water quality. Positive impact. Access to clean drinking water is crucial for overall health and hygiene. Negative impact. Polluted or contaminated water can lead to gastrointestinal diseases and other health problems. Light exposure. Positive influence. Natural light promotes vitamin D production and has positive effects on the sleep-wake rhythm and mood. Negative influence. Excessive exposure to artificial light, especially before bedtime, can interfere with sleep and increase the risk of sleep disorders. Noise level. Positive influence. A quiet environment promotes sleep and relaxation. Negative impact. Noise pollution can cause stress, disrupt sleep and increase the risk of cardiovascular disease. Climate and temperature. Positive influence. A temperate climate and pleasant temperatures promote well-being and physical health. Negative impact. Extreme heat or cold can cause health problems, including heat stroke or frostbite. Green surroundings. Positive impact. Access to nature and green spaces promotes physical activity, reduces stress and improves mental health. Negative impact. Lack of green spaces and nature can lead to an inactive lifestyle and poor mental health. Environmental toxins and chemicals. Positive impact. Minimizing exposure to harmful chemicals and environmental toxins promotes overall health. Negative impact. Contact with toxic substances can lead to various health problems, including respiratory problems, skin problems and cancer. Food quality. Positive impact. High quality, nutrient-rich foods promote overall health and can reduce the risk of diet-related diseases. Negative impact. Eating contaminated or poor quality food can lead to food poisoning and diet-related diseases. Social environment. Positive influence. A supportive social environment promotes well-being and mental health. Negative influence. Social isolation and stress in social relationships can lead to mental and physical health problems. Environmental impacts on lifestyle. Positive influence. An environment that promotes physical activity and a healthy lifestyle can have positive effects on health. Negative impact. An environment that limits access to healthy foods, safe places to exercise, and a supportive community can lead to an inactive lifestyle and health problems. Medical aspects. Medical aspects and their significance for health. Disease prevention. Vaccinations. Protection against infectious diseases through vaccinations. Screenings. Early detection of diseases through regular preventive examinations. Treatment of diseases. Drug therapy. Use of medications to treat diseases. Surgical procedures. Surgical procedures to remove tumors or correct anatomical problems. Management of chronic diseases. Long-term medication. Patients with chronic diseases often require lifelong medication. Lifestyle changes. Diet, exercise and stress management can play an important role in controlling chronic diseases. Pain management. Drug therapy. Use of painkillers to relieve acute or chronic pain. Physiotherapy. Use of physiotherapeutic measures for pain relief and rehabilitation. Healthcare. Counseling and education. Doctors play an important role in healthcare by educating patients about healthy lifestyle habits and risk factors. Early detection of risk factors. Identification of risk factors such as high blood pressure or diabetes for timely intervention. Rehabilitation. Physiotherapy and rehabilitation. After injuries or surgery. Rehabilitation is crucial to regaining functionality. Psychological support. Psychological care may be necessary to support patients after serious illnesses or operations. Health promotion. Health advice. Doctors can provide advice on promoting a healthy lifestyle. Preventive measures. Promoting health, promoting behaviors such as a balanced diet, regular exercise and stress management. Mental health. Psychiatric treatment. Treatment of mental illness through psychotherapy, medication, or a combination of both approaches. Early detection. Doctors play a role in identifying and treating mental health problems. Emergency care. First aid. Doctors and medical staff provide first aid in emergency situations. Emergency medicine. Treatment of life-threatening situations, such as heart attacks or accidents, in emergency rooms. Health information and education. Patient education. Doctors inform patients about their health conditions, treatment options and possible risks. Health promotion. Doctors help promote health literacy by educating patients about prevention and self-care. Therapeutic approaches and treatment options. Drug therapy. Histamine blocker. Antihistamines are often used to block the effects of histamine and relieve symptoms. DAO preparations. Diamine oxidase. DAO is an enzyme that breaks down histamine. DAO supplements can be used to compensate for the deficiency of this enzyme. Dietary change. Low histamine diet. Reduction of histamine-rich foods to reduce histamine exposure. Elimination diet. Gradual exclusion of potentially triggering foods to identify individual intolerances. Probiotics. Improve intestinal health. Probiotics can help support the balance of intestinal flora, which may have positive effects in some people with histamine intolerance. Dietary supplements. Vitamin and mineral supplements compensate for deficiencies that may arise due to limited food options. Omega-3 fatty acids. Anti-inflammatory effect that can help with some symptoms. Allergen immunotherapy. Desensitization. In some cases, immunotherapy can help reduce sensitivity to certain allergens. Stress management. Relaxation techniques. Using techniques such as meditation, yoga and breathing exercises to reduce stress that can aggravate symptoms. Physiotherapy. Breathing exercises. Physical therapists can guide breathing exercises to help relieve breathing difficulties. Relaxation techniques. Incorporating techniques to improve muscle relaxation. Alternative therapies. Acupuncture. Some people experience relief from histamine-related symptoms through acupuncture. Homeopathy. Some sufferers seek help through homeopathic approaches, although scientific evidence is limited. Psychotherapy. Cognitive behavioral therapy can help cope with the diagnosis and effects of histamine intolerance. Stress management. Support in developing coping strategies for stressful situations. Individual adaptation and self-management. Food diary. Keeping a diary to identify connections between diet, symptoms and other influencing factors. Self-management courses. Training in self-help and effective management of histamine intolerance. It is important to emphasize that the choice of treatment options depends greatly on individual needs, severity of symptoms, and the individual's response to different approaches. Working closely with physicians, nutritionists, and other professionals can help develop a comprehensive and effective treatment plan. Drug options. Histamine blocker. H1 antihistamines. block the action of histamine at the H1 receptors and can relieve symptoms such as rashes, itching and allergic reactions. H2 antihistamines reduce histamine production in the stomach and are often used to treat gastrointestinal complaints. Diamine oxidase, DAO, preparations. DAO enzyme supplements. These supplements contain the enzyme diamine oxidase, which can break down histamine in the stomach. They can help compensate for a DAO deficiency. Proton pump inhibitors, PPIs, reduce stomach acid production. PPIs can help with stomach discomfort and heartburn caused by increased histamine production in the stomach. Mast cell stabilizers stabilize mast cells. These medications can inhibit the release of histamine from mast cells and are used in some cases to treat allergic reactions. Antidepressants, selective serotonin reuptake inhibitors, SSRIs, may be used in some cases to treat gastrointestinal symptoms associated with histamine intolerance, such as irritable bowel syndrome. Anti-inflammatory drugs, corticosteroids, in severe inflammatory reactions. Corticosteroid medications may be used to reduce inflammation. Emergency medications, epinephrine adrenaline, in case of anaphylactic shock, which can be a life-threatening allergic reaction. Epinephrine is used as an emergency medication. Antiemetics, antinausea medication, in the case of histamine-related gastrointestinal complaints. Antinausea medication can be used to relieve nausea and vomiting. Naturopathic approaches, dietary change, low histamine diet, reduction of histamine-rich foods to minimize histamine exposure, elimination diet, gradual exclusion of potentially triggering foods to identify individual intolerances, nutrient-rich diet, focus on fresh, unprocessed foods with sufficient vitamins and minerals. Probiotics, promoting intestinal health. Probiotics can support the intestinal flora and help improve the tolerance of foods. Herbal medicine, quercetin, a natural antihistamine found in foods such as onions, apples and tea, may have anti-inflammatory effects. Nettle contains compounds that can stimulate histamine-degrading enzymes. Chamomile has anti-inflammatory properties and can have a soothing effect on the stomach. Colon cleansing and detox. Detoxification. Some people rely on gentle colon cleansing and detoxification measures to reduce the burden on the body. Acupuncture. Energetic harmonization. Acupuncture can aim to release energy blockages and promote balance in the body. Homeopathy. Individual remedies. Homeopathic preparations are often individually tailored to the symptoms and the person. Aromatherapy. Relief of symptoms. Some essential oils such as lavender or peppermint can have a calming effect and alleviate gastrointestinal complaints. Relaxation techniques. Meditation promotes relaxation and stress reduction. Yoga, combination of breathing exercises, postures and meditation to promote well-being. Homeostasis through movement. Qigong or Tai Chi, movement methods aimed at promoting life energy, qi, and promoting relaxation. Counseling and lifestyle changes. Psychological support. Counseling or psychotherapy to manage stress and promote a positive lifestyle. Self-management courses. Training to develop self-management skills and facilitate the management of histamine intolerance. Dealing with comorbidities. Irritable bowel syndrome. IBS. Low FODMAP diet. Reduction of fermentable carbohydrates. which can exacerbate symptoms in many people with IBS. Probiotics support gut health with probiotic supplements. Allergies and asthma. Allergen avoidance. Identifying and avoiding allergens to minimize allergic reactions. Asthma medications. Regular use of asthma medications to control respiratory symptoms. Gastrointestinal complaints. Dietary adjustments. Low histamine diet. Avoidance of problematic foods. Drug therapy. Use of medications such as antacids or acid blockers to relieve gastrointestinal complaints. Migraines and headaches. Trigger identification. Identification and avoidance of individual triggers for migraine attacks. Drug therapy. Use of medications for acute treatment or prophylaxis. Mental health. Stress, anxiety, depression. Psychotherapy. Support through talk therapy, cognitive behavioral therapy or other psychotherapeutic approaches. Stress management techniques. Incorporating techniques such as meditation, breathing exercises and progressive muscle relaxation. Skin diseases. Eczema, urticaria. Skin care. Use gentle, hypoallergenic skin care products. Antihistamines. Drug treatment of skin reactions with antihistamines. Joint pain. Arthralgia. Anti-inflammatory measures. Use of anti-inflammatory drugs or natural anti-inflammatories. Physiotherapy. Physiotherapeutic measures to relieve joint pain. Endocrine diseases. For example, thyroid problems. Regular medical checkups. Monitoring and adjustment of medication under medical supervision. Lifestyle management. Emphasis on a healthy lifestyle to support endocrine health. Cognitive impairments. Brain fog. Concentration problems. Breaks and rest. Planning breaks and getting enough sleep to support cognitive functions. Mental health support. Psychotherapy or counseling to help manage cognitive impairment. Cardiovascular diseases. Heart-healthy lifestyle. Emphasis on a heart-healthy diet, regular exercise, and stress management. Drug therapy. Continuous monitoring and adjustment of medication under the guidance of heart specialists. Doctor-patient communication and self-management. Open communication. Honest symptom description. Clear and honest communication about symptoms occurring and their effects. Asking questions. Actively asking questions to develop a deeper understanding of your own health. Understanding the diagnosis. Questions about histamine intolerance. Questions to understand the diagnosis. Causes and effects. Willingness to address ambiguities. Openness to further clarification if certain aspects are unclear. Joint development of a treatment plan. Collaboration with the physician. Shared decision-making in developing individual treatment plans. Setting realistic goals. Setting realistic goals regarding symptom control and quality of life. Develop self-management skills. Education and training. Active participation in training or self-management courses to deepen the understanding of histamine intolerance. Self-care practices. Developing self-care practices to better manage daily life. Keep a symptom diary. Documenting symptoms. Keeping a diary to identify connections between diet, stress and symptoms. Helpful information for the doctor. Symptom diary can help the doctor to recognize individual patterns and adjust the treatment plan. Regular doctor visits. Follow-up appointments. Regular review and adjustment of the treatment plan through scheduled doctor visits. Open communication. Discussing progress, challenges and changes in health status. self-responsibility for nutrition, low histamine diet, personal responsibility for food selection and adherence to the low histamine diet, knowledge of trigger foods, identifying and avoiding personal trigger foods, integration of lifestyle changes, exercise, integrating regular physical activity to promote overall health, stress management techniques, using stress management techniques such as meditation, yoga or breathing exercises, dealing with comorbidities, self-observation for possible concomitant diseases and timely communication with the doctor, involvement of professionals, collaboration with specialists in comorbidities to ensure comprehensive care, mental health in focus, open dialogue about mental health, willingness to talk about the effects of histamine intolerance on mental health, seek support, if necessary. Seek professional support for mental health challenges. Doctor-patient communication and self-management play a crucial role in managing histamine intolerance. Which vitamins are histamine blockers? It is important to understand that vitamins do not act directly as histamine blockers. Histamine is a natural substance in the body that is involved in various physiological processes. With histamine intolerance, people have difficulty breaking down histamine, which can lead to symptoms such as headaches, rashes, gastrointestinal upset, and others. Histamine blockers, usually called antihistamines, are medications that can block the effects of histamine in the body. However, there are some nutrients and vitamins that can play a supporting role in histamine intolerance by affecting certain functions in the body. These can help reduce histamine load or assist the body in dealing with histamine degradation. Some of these nutrients include vitamin C, an antioxidant that may support the activity of the enzyme diamine oxidase, DAO, which is responsible for the breakdown of histamine. Vitamin B6, pyridoxine, participates in histamine breakdown and supports DAO function. Vitamin B12 may help promote DAO activity. Copper, a trace element that may be involved in the production of DAO. Zinc, may support the activity of DAO. It is important to note that the effects of these nutrients are not the same for all people with histamine intolerance, and there are individual differences. Some people with histamine intolerance report improvements from supplementing with these vitamins, while others may have different reactions. It is recommended to consult a healthcare provider before taking any dietary supplements or vitamins. A nutritionist or allergist can also provide individual recommendations to manage histamine intolerance. Which Schussler salts are histamine blockers? Schussler salts, also known as biochemical mineral salts according to Dr. Schussler, are used in alternative medicine and are intended to supply the body with essential minerals. However, there is no scientific evidence that Schussler salts act directly as histamine blockers. Histamine is a natural substance in the body that is involved in various physiological processes. With histamine intolerance, people have difficulty breaking down histamine, which can lead to various symptoms. There are some Schussler salts that are discussed in alternative medicine for their possible role in allergies or intolerances. However, before using any Schussler salts or other alternative medicine approaches to treat histamine intolerance, it is important to discuss this with a healthcare provider. Some Schussler salts that may be considered are Schussler salt No. 3. Ferrum phosphoricum. This salt is sometimes considered to strengthen the immune system and to support allergic reactions. Schüssler salt no. 8. Natrium chloratum is occasionally recommended for regulating water balance and supporting the immune system. Schüssler salt no. 24. Arsenicum jodatum. This salt could be considered for allergic complaints, including skin problems. It is important to emphasize that the use of Schüssler salts and other alternative medicine approaches for histamine intolerance has not been scientifically proven. There are also no fixed recommendations or dosages for their use in this specific condition. A holistic approach that includes diet, lifestyle, and, if necessary, conventional medication should be taken under the guidance of healthcare providers. It is strongly recommended to speak to a doctor or experienced therapist before using Schüssler salts or other alternative medicine remedies. Which Bach flowers can help? Bach flower remedies are a form of alternative medicine based on the principles of British physician Dr. Edward Bach. They are often used for emotional support and to promote mental balance. When using Bach flower remedies for histamine intolerance or similar conditions, it should be noted that they are not designed to directly break down histamine or affect the enzymatic processes in the body. However, they may be helpful in managing emotional stressors that are affecting symptoms. Here are some Bach flower remedies that may be worth considering. Rock rose, for acute panic or anxiety that may be associated with allergic reactions. Cherry plum, when there are fears of losing control or extreme emotional outbursts. Mimulus, spotted mimulus, for specific fears, such as fear of certain foods or the symptoms of histamine intolerance. Agrimony, helpful in dealing with inner conflicts and hiding emotions that can have a negative impact on health. Vervain, when there is a tendency toward overcommitment or constant tension. Walnut, for changes and difficulties in adapting, especially with regard to dietary changes. It is important to note that the choice of Bach flower remedies is very individual and depends on the specific emotional states a person is experiencing. It is recommended to consult an experienced Bach flower therapist or a naturopath to identify the most suitable flowers for personal needs. It is also important to stress that Bach flowers should be considered a supportive measure and not a substitute for medical treatment for histamine intolerance or other health conditions. Smoking and histamine. Smoking can have various effects on the body, including potentially affecting histamine metabolism. Histamine is a natural substance in the body that is involved in many physiological processes, including the immune response and inflammation regulation. There are several possible connections between smoking and histamine metabolism. Inflammatory processes. Smoking can promote inflammatory processes in the body. Histamine is a substance that is released during inflammation. When inflammation in the body increases, this can also increase the release of histamine. Oxidative stress. Smoking creates oxidative stress in the body, which can lead to increased release of inflammatory mediators, including histamine. Changes in the immune system. Smoking can affect the immune system, and a disturbed immune response could affect the regulation of histamine. Vascular changes. Smoking can affect blood vessels, and histamine has been shown to play a role in regulating vascular tone. Changes in this area could affect histamine metabolism. It is important to note that the research on this topic is inconclusive, and the exact links between smoking and histamine metabolism are complex. There are also many other health effects of smoking, including cardiovascular disease, respiratory problems, and cancer. that are more serious than the potential effects on histamine metabolism. For people with histamine intolerance, it is advisable to avoid or stop smoking, as smoking not only has potentially negative effects on histamine metabolism, but also poses other health risks. If you have any questions or concerns, you should contact a healthcare provider for individualized advice. How to do a natural colon detox. A natural colon detox can help cleanse the colon and promote digestive health. It is important to note that there are different approaches to a colon detox and not all of them are suitable for every person. Before starting a colon detox, you should consult with a healthcare provider, especially if you have any health concerns or pre-existing medical conditions. Here are some general tips for natural colon detoxification. Dietary change. Increase your intake of fiber-rich foods such as fruits, vegetables, whole grains and legumes. Drink plenty of water to promote the elimination of waste products. Probiotics and fermented foods. Add probiotic foods like yogurt, sauerkraut, kimchi and kombucha to support gut flora. Probiotics in the form of dietary supplements can also be helpful. Herbal teas and infusions. Some herbal teas, such as peppermint, chamomile and ginger, can have a calming effect on the gastrointestinal tract. Movement. Regular physical activity can promote intestinal motility and support detoxification. Water and hydration. Drink plenty of water to hydrate your body and help eliminate waste products. Food abstinence and elimination diet. Avoid processed foods, sugar, artificial additives and potential allergens. Conducting an elimination diet to identify individual food intolerances. Therapeutic fasting. Under the guidance of a professional, intermittent fasting can help relieve the digestive tract and regenerate the body. Detox herbs and supplements. Some herbs, such as dandelion, coriander or milk thistle, are sometimes used for their detoxifying properties. Taking supplements specifically designed for detoxification should be done with caution and under the guidance of a healthcare provider. It is important to stress that there is no one-size-fits-all solution to a colon detox. Everyone is different and what works for one person may not be suitable for another. It is advisable to speak to a doctor or nutritionist before starting a colon detox to ensure it is suitable for your individual needs and health circumstances. Practical everyday tips and tricks. Grocery shopping and preparation. Low histamine shopping list. Make a list of low histamine foods and plan your shopping accordingly. Fresh preparation. Fresh, unprocessed foods often have lower histamine levels. Cooking techniques for histamine reduction. Short cooking times. Avoid long cooking times to minimize histamine formation. Be careful when using leftovers. Histamine can accumulate in leftovers. Therefore, meals should be freshly prepared. Low histamine recipes. Recipe collection. Create a collection of low histamine recipes for varied meals. Use online resources. Use online platforms and cooking blogs for specific low histamine recipe ideas. Restaurant visits. Inform yourself in advance. Before visiting a restaurant, find out about the menu and clarify your needs with the staff. Customization. Many restaurants can customize dishes to offer low histamine options. Meal planning. Plan ahead. Plan meals in advance to ensure you have low histamine foods available. Snack options. Have low histamine snack options on hand to avoid hunger between meals. Food intolerances in the social environment. Communication. Tell friends and family about your food intolerances to promote understanding. Shared meals. Look for shared meal options that work for everyone. Pay attention to food labeling. Read labels. Pay attention to food labels and choose products with low histamine content. Hidden histamine sources. Be aware of hidden histamine sources in foods, such as certain preservatives. Healthy lifestyle habits. Regular meals. Eat regularly to keep blood sugar levels stable and minimize fluctuations. Hydration. Drink plenty of water to support the body and promote the elimination of waste products. Emergency preparedness. Emergency kit. Have an emergency kit with low histamine snacks ready if needed. Emergency medications. If prescribed. Carry necessary medications to relieve histamine intolerance symptoms. Mindful lifestyle. Stress management. Practice stress management techniques such as meditation, yoga or breathing exercises. Mindful eating. Take time for each meal and focus on mindful eating. These practical tips and tricks can help make it easier to deal with histamine intolerance in daily life. It is important to consider individual needs and reactions and to consult with a healthcare provider if necessary. Low histamine recipes and cooking ideas. Here are some low histamine recipes and cooking ideas that can support the variety of your meals. Vegetable soup. Ingredients: carrots, celery, zucchini, potatoes. Vegetable stock. Preparation: dice the vegetables. Cook in vegetable stock. Puree and season with fresh herbs. Grilled chicken with lemon herb marinade. Ingredients: chicken breast, lemon, olive oil, fresh herbs, basil. Time. Preparation: brush chicken with marinade. Grill. Garnish with lemon slices and fresh herbs. Quinoa salad with fresh vegetables. Ingredients: quinoa, tomatoes, cucumbers, peppers, spring onions, olive oil. Preparation: cook quinoa. Dice vegetables. Mix with olive oil and serve as a refreshing salad. Salmon fillet with dill mustard sauce. Ingredients: salmon fillet, fresh dill, mustard, lemon. Preparation: spread the salmon with dill mustard sauce. Bake in the oven and garnish with lemon slices. Vegetable curry with coconut milk. Ingredients: mixed vegetables, broccoli, carrots, peas, coconut milk, curry spice. Preparation: simmer vegetables in coconut milk with curry spices and serve. Baked sweet potatoes with avocado topping. Ingredients: sweet potatoes, avocado, coriander, lime juice. Preparation: bake sweet potatoes and garnish with avocado, coriander and lime juice. Chicken salad with arugula and strawberries. Ingredients: chicken breast, arugula, strawberries, almonds, balsamic dressing. Preparation: grill the chicken. Arrange on rocket with strawberries and almonds. Drizzle with dressing. Spinach omelette with tomatoes. Ingredients: eggs, fresh spinach, tomatoes, feta cheese. Preparation: mix eggs with spinach, tomatoes and feta and fry to make an omelette. Low histamine smoothie. Ingredients: banana, berries, blueberries, strawberries, almond milk. Preparation: mix all ingredients until a creamy smoothie is formed. Vegetable noodle pan. Ingredients: zucchini noodles, tomatoes, peppers, olive oil, fresh herbs. Preparation: fry vegetable noodles in olive oil. Mix with tomatoes and peppers. Season with herbs. These low histamine recipes offer a range of delicious and healthy options. Remember that individual tolerances may vary, so it's important to pay attention to your body's reactions and consult a healthcare provider if you're unsure which noodles are low in histamine. The histamine load of foods can vary, and there are no specific types of pasta that are generally considered low in histamine. However, if you have histamine intolerance, it is advisable to choose foods that are generally considered low in histamine. Here are some guidelines for choosing pasta if you have histamine intolerance. Fresh pasta. Freshly prepared pasta usually contains less histamine than dried pasta, so it might be a better option. Wheat pasta. Pasta made from wheat flour is often considered to be low in histamine. However, whole wheat pasta can have higher histamine levels than refined wheat pasta. Gluten-free pasta. Gluten-free alternatives such as rice noodles, corn flour noodles, millet noodles or pasta made from chickpea flour may be better tolerated by some people with histamine intolerance. Rinse before cooking. It is recommended to rinse pasta well before cooking to remove any residue and reduce histamine levels. Fresh preparation. Freshly prepared pasta dishes where you can control the ingredients and sauces are often a safer option than processed convenience foods. Make your own wheat noodles. Ingredients: 2 cups all-purpose flour, 2 large eggs, pinch of salt, water, as needed. Preparation: prepare the flour. Sift the all-purpose flour into a large bowl to loosen it. Add eggs. Make a well in the center of the flour and crack the eggs into it. Also add a pinch of salt. Knead the dough. Using a fork, begin to slowly mix the eggs into the flour. Then begin to knead with your hands. Add water as needed to form a smooth dough. Let the dough rest. Wrap the dough in plastic wrap and let it rest for about 30 minutes. This will help the dough to relax and make the pasta easier to roll out later. Roll out the pasta dough. Divide the dough into smaller portions. Using a rolling pin, roll out each portion thinly on a floured surface, making sure the dough is evenly thin. Cutting pasta. You can cut the pasta however you like. For simple tagliatelle, you can roll the dough into a log and then cut it into thin slices. Let the pasta dry. Spread the cut pasta on a clean, lightly floured cloth or tray and let it dry for about 15-30 minutes. Cooking pasta. Cook the fresh pasta in a pot of plenty of salted boiling water for about 2-3 minutes. The exact cooking time depends on the thickness of the pasta. Drain and serve. Drain the pasta and serve with your favorite sauce if desired. Enjoy your homemade wheat noodles. Note that you can adjust the consistency of the dough and the thickness of the noodles according to your personal taste. Make your own rice noodles. Ingredients: 2 cups rice flour, 1 cup of water, 2 teaspoons salt. Preparation: prepare rice flour. Sift the rice flour into a large bowl to avoid lumps. Add salt. Add the salt to the rice flour and mix well. Prepare the dough. Gradually pour water into the rice flour while stirring until you get a smooth dough. The dough should have a consistency similar to pancake batter. Let the dough rest. Let the dough rest for about 30 minutes. This allows the rice flour to absorb the water and make the dough more elastic. Roll out the dough thinly. Divide the dough into smaller portions. On a lightly floured surface, roll each portion out into a thin disc, making sure the dough is evenly thin. Cutting pasta. Gently fold the thin dough and cut it into thin strips. The width of the strips depends on your preference for pasta width. Let the noodles dry. Spread the cut rice noodles on a clean, lightly floured cloth or tray and let them dry for about 30–60 minutes. Cooking pasta. Cook the dried rice noodles in a pot of plenty of boiling water for about 3–5 minutes until soft. Drain and serve. Drain the rice noodles and serve in soups, stir-fries or salads as desired. Tip: rice noodles tend to cook quickly, so check their consistency regularly to make sure they don't become too soft. Enjoy your homemade rice noodles. They are great for Asian dishes and are a gluten-free option. Make your own corn flour noodles. Ingredients: 2 cups corn flour, finely ground, 2 eggs, 1/2 teaspoon salt, water, as needed. Preparation: prepare the corn flour. Sift the corn flour into a large bowl to avoid lumps. Add eggs. Make a well in the center of the cornmeal and crack the eggs into it. Add the salt as well. Knead the dough. Using a fork, begin to slowly mix the eggs with the corn flour. Then begin to knead with your hands. Add water as needed to form a smooth dough. Let the dough rest. Wrap the dough in plastic wrap and let it rest for about 30 minutes. This will help the dough to relax and make the pasta easier to roll out later. Roll out the dough. Divide the dough into smaller portions. Using a rolling pin, roll out each portion thinly on a floured surface, making sure the dough is evenly thin. Cutting pasta. You can cut the pasta however you like. For wide ribbon pasta, you can cut the dough into strips. Let the noodles dry. Spread the cut cornmeal noodles on a clean, lightly floured cloth or tray and let them dry for about 15–30 minutes. Cooking pasta. Cook the fresh corn flour noodles in a pot of plenty of salted boiling water for about 2–4 minutes. The exact cooking time depends on the thickness of the noodles. Drain and serve. Drain the cornmeal noodles and serve with your favorite sauce if desired. Enjoy your homemade cornmeal noodles. These noodles are great for gluten-free options and can be used in various dishes such as stir-fries, soups or salads. Shopping strategies for low-histamine diets. Choosing low-histamine foods requires special attention when shopping. Here are some shopping strategies for a low-histamine diet. No histamine poor foods. Learn about low-histamine foods to help you make the right choices when shopping. These include fresh meat, fresh fish, fresh eggs, many fresh vegetables and some fruits. Prefer fresh, unprocessed foods. Fresh meat, fish, eggs, vegetables and fruit often have lower histamine levels than processed foods. Avoid highly processed foods, which often contain histamine-rich additives. Pay attention to the expiration date. Buy foods with a later expiration date to ensure you get fresh produce. Choose seasonal and regional products. Fresh, seasonal, local fruits and vegetables may be a better option as they are likely to be fresher and have been stored for less time. Consider organic products. Organic products may contain fewer pesticides and are often offered fresher. Choose spices and herbs carefully. Some spices and herbs can release histamine. Choose carefully and limit the use of strongly aromatic spices. Check food labeling. Read the ingredient lists and nutritional information on packaged foods carefully. Avoid foods with histamine-rich additives such as certain preservatives. Make several small purchases. Instead of buying large quantities at once, make smaller purchases to ensure you can consume fresh food before it spoils. Use online resources. Use online resources to find food lists and shopping tips for low histamine diets. There are websites and apps designed specifically for people with histamine intolerance. Prefer homemade. If possible, Prepare food yourself to maintain control over the ingredients. This is especially true for sauces, seasoning mixes and ready meals. Plan in advance. Plan your meals in advance and create a shopping list so you can specifically look for low histamine foods. Try alternative products. Try alternative products such as gluten-free pasta, milk alternatives or other foods to see if they are better tolerated. It is important to note that individual tolerances may vary. People with histamine intolerance should adjust their diet individually and consult a healthcare provider or nutritionist if unsure. Social aspects. Histamine intolerance among friends and family. The social aspects of histamine intolerance can be challenging as it affects not only a person's eating habits but also social interactions. Here are some considerations for dealing with histamine intolerance in friends and family circles. Open communication. Tell your family and friends about your histamine intolerance. Explain what it means and how it affects your diet. Plan meals together. If possible, plan shared meals in advance so everyone is prepared. This gives you the opportunity to adjust meals or suggest alternative dishes. Share recipes. Share low histamine recipes with your loved ones to give them an idea of what foods are suitable for you. You could even cook together and thus promote understanding of your needs. Explain hospitality. If you're invited, politely explain your limitations. Many people are willing to adjust and accommodate you if they understand why it's important. Additional consideration. Encourage your family and friends to be considerate when planning meals together. This could include choosing restaurants with low histamine options or incorporating foods that work for you. Facilitate self-care. Make it easy for your friends and family to care for you. Share what foods and brands you prefer to avoid misunderstandings. Take personal responsibility. Take responsibility for your own diet. When attending group events, consider bringing your own food to ensure you have something you can eat. Show openness to alternatives. Be open to alternatives and compromises. This can make the social aspect easier without anyone having to conform too much. Find common interests. Find common interests that aren't food-based. This can help shift the focus away from the restrictions of your diet. Accepting help. If friends or family members offer to help prepare meals, accept the offer. This can maintain the social aspect while respecting your dietary needs. Enjoyment despite histamine intolerance. Despite histamine intolerance, it is possible to maintain the enjoyment of food and enjoy a varied and tasty diet. Here are some tips on how you can maintain enjoyment despite histamine intolerance. Discover new recipes. Experiment with low histamine recipes. There are many delicious and varied dishes that do not contain histamine-rich foods. Select spices and herbs. Choose spices and herbs carefully, as some are more histamine-friendly than others. Fresh herbs such as parsley, chives and basil can be a flavorful alternative. Use fresh, seasonal foods. Use fresh and seasonal foods to maximize flavor. These are often not only more flavorful but may also contain less histamine. Homemade sauces and dressings. Make your own sauces and dressings to keep control over the ingredients. Fresh ingredients can enhance the flavor. Find alternatives for favorite dishes. Look for alternatives to your favorite dishes by trying creative combinations of ingredients. This can maintain enjoyment without compromising tolerance. Low histamine snacks. Have low histamine snacks on hand to satisfy hunger between meals. Fresh fruit, vegetables, or nuts with low histamine content can be good options. Bring your own meals. If you are invited to events, you may want to bring your own meals to ensure you have something enjoyable. Eat slowly and enjoy. Take your time to enjoy meals. Eating slowly can not only increase enjoyment, but also help minimize digestive problems. Share with others. Share your culinary discoveries with friends and family. This can help foster understanding and support. Self-care and stress management. Histamine intolerance symptoms can be exacerbated by stress. Incorporate self-care practices and stress management techniques into your daily routine. Food compatibility tested. If possible, seek advice from a specialist and undergo food tolerance testing to find out exactly which foods are suitable for you personally. 7-day diet cooking plan with delicious recipes. Day 1. Breakfast. Greek yogurt with fresh strawberries and chia seeds. Wholemeal bread with little butter. Lunch. Grilled chicken breast fillet with quinoa and steamed spinach. Grilled chicken breast fillet. Ingredients: 2 chicken breast fillets, 2 tablespoons olive oil, 1 teaspoon paprika, 1 teaspoon garlic powder, salt and pepper to taste. Directions: wash the chicken breast fillets and pat dry. In a bowl, combine olive oil, paprika, garlic powder, salt and pepper to make a marinade. Turn the chicken breast fillets in the marinade and let them marinate in the refrigerator for at least 30 minutes. Preheat the grill. Remove the chicken breasts from the marinade and grill on the hot grill for about 6-8 minutes on each side or until cooked through. Remove the chicken breast fillet from the grill and let it rest briefly before serving. Quinoa. Ingredients: 1 cup quinoa, 2 cups water or vegetable broth, salt to taste. Directions: the quinoa well under cold water to remove the bitter substances. Quinoa to the boil in a saucepan with water or vegetable stock and a pinch of salt. Reduce the heat. Cover the pot and simmer the quinoa over low heat for about 15 minutes, until the liquid is absorbed and the quinoa has puffed slightly. Remove the pot from the heat and let the quinoa rest covered for another 5 minutes. Then loosen it with a fork. Steamed spinach. Ingredients: 200 grams fresh spinach, washed and spun dry, 1 tablespoon olive oil, 1 garlic clove, chopped. Optional. Salt and pepper to taste. Directions: heat the olive oil in a pan. If desired, add the chopped garlic and fry briefly until fragrant. Add the fresh spinach to the pan and stir gently until it wilts. Season with salt and pepper and sauté the spinach until it has just wilted. Serve the grilled chicken breast fillet on a bed of quinoa and with steamed spinach. If you like, you can use fresh herbs, lemon juice or a slightly spicy yogurt sauce as a topping. Dinner: baked salmon with dill sauce, sweet potato wedges, colorful vegetable salad with olive oil and lemon juice, baked salmon with dill sauce. Ingredients for the salmon: 4 salmon fillets, 2 tablespoons olive oil, salt and pepper to taste, lemon slices for garnish. Ingredients for the dill sauce: 1/2 cup Greek yogurt, 1 tablespoon fresh dill, finely chopped, 1 tablespoon lemon juice, salt and pepper to taste. Directions: preheat the oven to 200 degrees Celsius. Wash the salmon fillets and pat dry. Brush with olive oil and season with salt and pepper. Place the salmon fillets on a baking sheet lined with baking paper and bake for about 15-20 minutes or until the salmon is cooked through. While the salmon is baking, prepare the dill sauce by combining all ingredients in a bowl. The baked salmon with dill sauce and garnish with lemon slices. Sweet potato wedges. Ingredients: 2 large sweet potatoes, peeled and cut into wedges. 2 tablespoons olive oil. 1 teaspoon paprika powder. 1 teaspoon garlic powder. Salt and pepper to taste. Directions: preheat the oven to 220 degrees Celsius. Place the sweet potato wedges in a bowl and toss with olive oil, paprika, garlic powder, salt and pepper until the wedges are evenly coated. Spread the sweet potato wedges on a baking sheet lined with parchment paper and bake for about 25–30 minutes, or until golden brown and crispy. Colorful vegetable salad with olive oil and lemon juice. Ingredients: 2 cups mixed fresh vegetables, for example, tomatoes, cucumbers, peppers, radishes, washed and diced. 2 tablespoons extra virgin olive oil. Juice of half a lemon. Fresh basil or parsley, chopped. Salt and pepper to taste. Directions: place the chopped vegetables in a large bowl. Add olive oil and lemon juice. Then stir gently. Season with fresh herbs, salt and pepper. Let the salad sit for at least 15 minutes before serving so that the flavors blend well. Serve the baked salmon on a bed of sweet potato wedges and serve the colorful vegetable salad on the side. This meal is not only delicious, but also rich in omega-3 fatty acids, vitamins and fiber. Day 2. Breakfast: smoothie with berries, spinach, banana and almond milk. Oatmeal with a teaspoon of honey. Lunch: lentil salad with tomatoes, cucumbers and feta cheese. Whole grain pita bread. Ingredients for the lentil salad: 1 cup green or brown lentils, cooked and cooled. 1 large tomato, diced. 1/2 cucumber, diced. 100 grams feta cheese, diced or crumbled. 1 red onion, finely chopped. Fresh parsley, chopped. To taste: extra virgin olive oil, red wine vinegar, salt and pepper to taste. Directions: place the cooked lentils in a large bowl. Add tomatoes, cucumber, feta cheese and red onion. Season with olive oil, red wine vinegar, salt and pepper to taste. Mix everything well and garnish with fresh parsley. Let the lentil salad sit in the fridge before serving. Whole grain pita bread. Ingredients: whole grain pita breads, olive oil, garlic powder, optional. Fresh parsley or coriander, chopped, optional. Directions: preheat the oven to 180 degrees Celsius. Brush the pita breads lightly with olive oil. You can also add some garlic powder if you like. Bake the pita breads in the oven for about 5–7 minutes or until slightly crispy. Garnish with fresh parsley or cilantro if desired. Serve the lentil salad on a plate, garnished with additional herbs and accompanied by warmed whole wheat pita bread. This dish is not only nutritious, but also rich in fiber, protein and healthy fats. If lentils are not suitable or desired, you can use a variety of alternatives for the salad. Here is an alternative with chickpeas. Chickpea salad with tomatoes, cucumbers and feta cheese. Ingredients for the chickpea salad: 1 can of chickpeas, rinsed and drained. 1 large tomato, diced. 1/2 cucumber, diced. 100 grams feta cheese, diced or crumbled. 1 red onion, finely chopped. Fresh parsley, chopped. To taste: extra virgin olive oil, red wine vinegar, salt and pepper to taste. Directions: place the rinsed and drained chickpeas in a large bowl. Add tomatoes, cucumber, feta cheese and red onion. Season with olive oil, red wine vinegar, salt and pepper to taste. Mix everything well and garnish with fresh parsley. Let the chickpea salad sit in the fridge before serving. Dinner. Vegetable curry with tofu. Quinoa as a side dish. Vegetable curry with tofu. Ingredients: 200 grams firm tofu, diced. 2 tablespoons of oil, for example coconut oil or rapeseed oil. 1 onion, chopped. 2 garlic cloves, chopped. 1 tablespoon fresh ginger, grated. 1 red pepper, cut into strips. 1 yellow pepper, cut into strips. 1 zucchini, diced. 1 carrot, cut into thin slices. 200 grams cauliflower florets. 2 tomatoes, diced. 400 milliliters coconut milk. 2 tablespoons curry paste, to taste. 1 teaspoon of turmeric. Salt and pepper to taste. Fresh coriander for garnish, optional. Lime wedges for serving. Directions: fry the tofu in a pan with a little oil until golden brown and crispy. Set aside. Heat the remaining oil in a large saucepan and fry the onion, garlic and ginger until fragrant. Add the pepper, zucchini, carrot and cauliflower and fry briefly until the vegetables are lightly browned. Add tomatoes, coconut milk, curry paste and turmeric. Stir well and bring to a boil. Reduce the heat and simmer the vegetables over low heat until tender. Add the fried tofu and season the curry with salt and pepper. Garnish with fresh coriander and serve with lime wedges. Quinoa as a side dish. Ingredients: 1 cup quinoa, 2 cups water or vegetable broth. Salt to taste. Directions: the quinoa well under cold water to remove the bitter substances. Quinoa to the boil in a saucepan with water or vegetable stock and a pinch of salt. Reduce the heat. Cover the pot and simmer the quinoa over low heat for about 15 minutes, until the liquid is absorbed and the quinoa has puffed slightly. Remove the pot from the heat and let the quinoa rest covered for another 5 minutes. Then loosen it with a fork. Serve the vegetable curry with tofu over a portion of quinoa. Not only is this dish rich in protein and healthy vegetables, but it's also full of delicious flavors from Asian cuisine. Day 3. Breakfast. Whole grain muesli with low-fat milk and a handful of walnuts. Fresh fruit salad. Lunch. Wholemeal pasta with tomato basil sauce and grated parmesan. Green salad with avocado. Whole wheat pasta with tomato basil sauce and grated parmesan. Ingredients: 250 grams whole wheat pasta. 2 tablespoons olive oil. 1 onion, chopped. 2 garlic cloves, chopped. 500 grams ripe tomatoes, diced. 1 can of chopped tomatoes, approximately 400 g. 1 teaspoon dried oregano. 1 teaspoon dried basil or fresh basil to taste. Salt and pepper to taste. 50 grams freshly grated parmesan. Fresh basil for garnish. Directions: cook the whole wheat pasta in salted water according to the package instructions until al dente. Drain and set aside. Heat olive oil in a pan. Fry the onion and garlic until soft. Add the diced tomatoes and simmer for about 5 minutes until soft. Add the chopped tomatoes, oregano and dried basil or fresh basil. Season with salt and pepper. Simmer over low heat for about 15-20 minutes. Add the cooked whole wheat pasta to the sauce and mix well so that the pasta absorbs the flavors. Sprinkle the freshly grated parmesan over the pasta and stir until melted. Garnish with fresh basil and serve immediately. Green salad with avocado. Ingredients: mixed green leaves, for example rocket, spinach, lamb's lettuce, 1 avocado, sliced, Cherry tomatoes, halved. 1 tablespoon extra virgin olive oil. Juice of half a lemon. Salt and pepper to taste. Directions. Arrange the green leaves on a serving plate. Slice the avocado and place the halved cherry tomatoes on top. Drizzle olive oil and lemon juice over it. Season with salt and pepper to taste. Stir gently to combine the ingredients. Serve the whole wheat pasta with tomato and basil sauce on a plate, sprinkled with grated Parmesan cheese, and serve the green salad with avocado as a refreshing side dish. This dish is not only delicious, but also rich in fiber, vitamins and healthy fats. Dinner. Grilled chicken breast with rosemary, broccoli and carrots steamed. Brown rice. Grilled chicken breast with rosemary. Ingredients. 2 chicken breast fillets. 2 tablespoons olive oil. 2 garlic cloves, chopped. 1 tablespoon fresh rosemary, chopped. Juice of half a lemon. Salt and pepper to taste. Directions. Preheat the grill. Wash the chicken breast fillets and pat dry. In a bowl. Combine olive oil, chopped garlic, chopped rosemary, lemon juice, salt and pepper to make a marinade. Turn the chicken breast fillets in the marinade and let them marinate in the refrigerator for at least 30 minutes. Grill the marinated chicken breast fillets on the hot grill for about 6-8 minutes on each side or until cooked through. Allow the grilled chicken to rest briefly before serving. Broccoli and carrots steamed. Ingredients. 1 broccoli, cut into florets. 2 carrots, cut into thin slices. 2 tablespoons olive oil. 1 garlic clove, chopped. Salt and pepper to taste. Directions. Heat the olive oil in a pan. Briefly fry the chopped garlic until it smells fragrant. Add broccoli and carrot pieces and sauté, stirring occasionally, until vegetables are tender but still have some bite. Season with salt and pepper. Brown rice. Ingredients. 1 cup brown rice. 2 cups of water. Salt to taste. Directions. Rinse the brown rice well under cold water to remove excess starch. Bring the cleaned rice to the boil in a saucepan with water and a pinch of salt. Reduce heat. Cover pot, and simmer rice over low heat for about 40-45 minutes or until cooked through. Remove the pot from the heat and let the rice rest covered for another 5 minutes. Then fluff it up with a fork. Serve the grilled chicken breast on a bed of brown rice, accompanied by steamed broccoli and carrots. This dish is high in protein, full of healthy vegetables and includes fiber-rich brown rice. Day 4. Breakfast. Scrambled eggs with peppers and spinach. Whole grain rolls. Lunch. Chicken goulash with peppers and potato dumplings. Black beans as a side dish. Chicken goulash. Ingredients. 500 grams chicken breast, cut into bite-sized pieces. 2 onions, chopped. 2 peppers, red and yellow, cut into strips. 2 garlic cloves, chopped. 2 tablespoons paprika powder, sweet. 1 teaspoon of caraway seeds. 400 milliliters chicken broth. 2 tablespoons tomato paste. Salt and pepper to taste. 2 tablespoons oil for frying. Directions. Fry the chicken in a pan with oil until golden brown. Remove from the pan and set aside. Fry the chopped onions in the same pan until soft. Add the garlic and continue to fry briefly. Stir in the paprika powder and caraway seeds. Add the pepper strips and fry for about 5 minutes. Return the browned chicken to the pan. Add chicken stock and tomato paste. Mix everything well. Bring the goulash to a boil. Then reduce the heat and simmer for about 30-40 minutes until the chicken is tender. Season with salt and pepper. Potato dumplings. Ingredients: 700 grams floury potatoes, peeled and boiled. 100 grams potato starch. 1 egg. 1 teaspoon salt. A pinch of nutmeg. Directions: mash the cooked potatoes or press them through a potato ricer. Add potato starch, egg, salt and nutmeg. Mix everything together to form a smooth dough. Form small dumplings from the dough. Cook the dumplings in boiling salted water for about 15-20 minutes until they float to the surface. Serve the chicken goulash on a plate, garnished with fresh parsley, along with the potato dumplings. This dish brings the hearty taste of Austrian cuisine to the table. Dinner: vegetarian vegetable pan with tofu. Quark dip with herbs. Vegetarian vegetable stir fry with tofu. Ingredients: for the vegetable pan: 200 grams tofu, diced. 2 tablespoons soy sauce. 2 tablespoons sesame oil. 1 onion, thinly sliced. 2 carrots, cut into thin slices. 1 bell pepper, cut into strips different colors. 1 zucchini, sliced. 150 grams mushrooms, sliced. 2 garlic cloves, chopped. 1 teaspoon fresh ginger, grated. 2 tablespoons of hoisin sauce. 1 tablespoon rice vinegar. Fresh coriander or parsley for garnish. Sesame seeds for sprinkling. Optional. Salt and pepper to taste. Directions: marinate the diced tofu in a bowl with soy sauce and set aside. Heat sesame oil in a large pan. Add onions, carrots, bell peppers, zucchini, mushrooms, garlic and ginger. Stir fry until vegetables are lightly browned. Add the marinated tofu and continue frying until golden brown. Hoisin sauce and rice vinegar to the pan. Mix well and simmer until the vegetables and tofu are cooked through. Season with salt and pepper. Garnish with fresh coriander or parsley and optionally sprinkle with sesame seeds. For the quark dip with herbs. Ingredients: 200 grams quark. 2 tablespoons of yogurt. Fresh herbs. For example chives, parsley, dill, finely chopped. 1 garlic clove, pressed. Salt and pepper to taste. A splash of lemon juice. Optional. Directions: mix the quark and yogurt in a bowl. Add fresh herbs and garlic. Stir well. Season with salt, pepper and optionally lemon juice. Allow the dip to sit in the fridge before serving. Serve the vegetarian vegetable stir fry with tofu on a plate and serve the quark dip as a refreshing side dish. This dish is not only delicious, but also rich in protein, fiber and healthy vegetables. Day 5. Breakfast: buckwheat pancakes with fresh berries and yogurt. A glass of freshly squeezed orange juice. Lunch: chicken salad with apples, celery and walnuts. Whole grain bread. Chicken salad with apples, celery and walnuts. Ingredients: for the chicken salad: 2 chicken breast fillets, cooked and cut into small cubes. 2 apples, washed, cored and cut into small pieces. 2 celery sticks, cut into thin slices. 1 cup walnuts, roughly chopped. 1 stroke 2 cup Greek yogurt. 2 tablespoons mayonnaise. Juice of 1 lemon. Salt and pepper to taste. Fresh chives or parsley for garnish. For the wholemeal bread: whole grain bread of your choice. Directions: chicken salad: cut the cooked chicken breast fillets into small cubes and place them in a large bowl. Add the washed and chopped apples, celery sticks and roughly chopped walnuts. Are well combined. Season the chicken salad with salt and pepper to taste. Before serving, Leave in the fridge for at least 30 minutes to allow the flavors to develop properly. Garnish with fresh chives or parsley. Whole grain bread. Cut the wholemeal bread into slices as desired. Serve the chicken salad with apples, celery and walnuts on a plate and serve the whole grain bread on the side. This dish is not only healthy and full of flavor, but also offers a good balance of protein, fiber and healthy fats. Dinner. Grilled pike perch with lemon butter. Cauliflower puree. Mixed salad. Grilled pike perch with lemon butter. Ingredients. For the grilled pike perch: 4 pike perch fillets, 2 tablespoons olive oil, salt and pepper to taste, fresh lemon slices for garnish. For the lemon butter: 1 stroke 2 cup unsalted butter, juice of 1 lemon, 2 tablespoons fresh parsley, chopped, salt and pepper to taste. Directions. Grilled pike perch. Preheat the grill. Brush the pike perch fillets with olive oil and season with salt and pepper. Grill the pike perch fillets on the grill for about 3-4 minutes per side or until the fish is cooked through. Garnish with fresh lemon slices. Lemon butter. Melt the butter in a small saucepan. Add lemon juice and chopped parsley. Stir well. Season with salt and pepper. Cauliflower puree. Ingredients: 1 large cauliflower, cut into florets, 2 garlic cloves, chopped, 2 tablespoons olive oil, salt and pepper to taste. Vegetable broth. Optional. For steaming. Directions. Steam the cauliflower florets in a steamer until tender. Alternatively, you can cook them in vegetable stock. Place the cooked cauliflower florets in a blender. Add garlic, olive oil, salt and pepper. Puree everything to a creamy consistency. If necessary, you can add a little vegetable stock to achieve the desired consistency. Mixed salad. Ingredients: mixed green leaves, for example rocket, spinach, lamb's lettuce, cherry tomatoes, halved, cucumber, sliced, red onion, cut into thin rings, balsamic dressing. Directions. Arrange the mixed green leaves on a serving plate. Spread cherry tomatoes, cucumber and red onion on top. Drizzle with balsamic dressing. Serve the grilled pike perch on a bed of cauliflower puree, garnished with lemon butter, and serve the mixed salad as a refreshing side dish. This dish is not only delicious, but also rich in protein, healthy fats and vegetables. Day 6. Breakfast. Muesli with low-fat milk, banana slices and almonds. A glass of green tea. Lunch. Quinoa vegetable pan with herb curd and wholemeal bread. For the quinoa vegetable stir-fry. Ingredients: 1 cup quinoa, rinsed thoroughly. 2 cups vegetable broth. 2 tablespoons olive oil. 1 onion, chopped. 2 carrots, washed and cut into cubes. 1 pepper, washed and cut into strips. 1 zucchini, washed and diced. 2 garlic cloves, chopped. A handful of fresh spinach, roughly chopped. Salt and pepper to taste. Fresh herbs, for example parsley or chives, for garnishing. For the herb curd. Ingredients: 200 grams quark, 2 tablespoons of natural yogurt. Fresh herbs, for example chives, parsley, finely chopped. Salt and pepper to taste. A splash of lemon juice. As a side dish, wholemeal bread. Directions: quinoa vegetable stir-fry. The quinoa in the vegetable stock according to the instructions on the packet until it has risen slightly and the liquid has been absorbed. Heat the olive oil in a pan. Fry the chopped onion and garlic until soft. Add the carrots, peppers and zucchini. Cook, stirring occasionally, until the vegetables are lightly browned. The cooked quinoa and chopped spinach to the pan. Mix everything well and season with salt and pepper. Remove the pan from the heat and cover to allow the spinach to wilt slightly. Herb curd. Mix the quark with yacht, chopped herbs, salt, pepper and a dash of lemon juice. Serve the quinoa and vegetable stir fry on a plate, garnished with fresh herbs, and serve the herb curd as a refreshing side dish. Serve with wholemeal bread as a healthy and fiber-rich addition. This dish is not only delicious, but also rich in protein, fiber, and various vegetables. Dinner. Beef fillet strips with mushrooms and broccoli. Sweet potato mash. Beef fillet strips with mushrooms and broccoli. Ingredients. For the beef fillet strips: 400 grams beef fillet, cut into strips. 2 tablespoons olive oil. 2 garlic cloves, chopped. 200 grams mushrooms, sliced. 1 broccoli, cut into florets. Salt and pepper to taste. Fresh parsley for garnish. For the marinade: 2 tablespoons soy sauce. 1 tablespoon Worcestershire sauce. 1 teaspoon of honey. 1 teaspoon mustard. 1 teaspoon paprika powder. For the sweet potato mash: 4 large sweet potatoes, peeled and diced. 2 tablespoons butter. 1/4 cup milk, as needed. Salt and nutmeg to taste. Directions. Beef fillet strips. Mix the beef fillet strips with the ingredients for the marinade and let marinate for at least 30 minutes. Heat olive oil in a large skillet. Add the marinated beef fillet strips and fry until evenly browned. Remove from the pan and set aside. In the same pan, fry chopped garlic. Add the mushrooms and broccoli florets. Cook, stirring occasionally, until the vegetables are tender. Put the fried beef fillet strips back into the pan. Mix everything well and season with salt and pepper. Garnish with fresh parsley. Sweet potato mash. Cook the diced sweet potatoes in a pot of water until soft. Drain the cooked sweet potatoes and return them to the pot. Add butter, milk, salt and nutmeg. Mash everything with a potato masher until it becomes a creamy puree. Add more milk if necessary. Serve the beef fillet strips with mushrooms and broccoli on a plate, garnished with fresh parsley, and serve the sweet potato mash as a delicious side dish. This dish combines tender beef fillet strips with hearty vegetables and a creamy sweet potato mash. Day 7. Breakfast. Yacht with honey, oat flakes and sliced strawberries. Whole grain roll with cheese. Lunch. Wholemeal pasta with pesto, cherry tomatoes and arugula. Mixed salad with olives. Ingredients. For the whole wheat pasta: 300 grams whole grain pasta. Salt for the pasta water. For the pesto: 2 cups fresh basil. 1/2 cup grated Parmesan cheese. 1/3 cup toasted pine nuts. 2 garlic cloves, chopped. 1/2 cup olive oil. Salt and pepper to taste. For the filling: 1 cup cherry tomatoes, halved. 2 handfuls of fresh arugula. For the garnish: freshly grated Parmesan cheese. Pine nuts, optional. Directions. Whole grain pasta. Cook the whole wheat pasta in a large pot of salted water according to the package directions until al dente. Drain and set aside. Pesto. Place basil, Parmesan, pine nuts and garlic in a blender or food processor. Turn on the device and slowly add the olive oil until a smooth paste is formed. Season with salt and pepper to taste. Completion. Place the cooked whole wheat pasta in a large bowl. Pour the pesto over the pasta and mix well until the pasta is evenly coated. Add the halved cherry tomatoes and fresh rocket. Stir gently to ensure the ingredients are evenly distributed. Garnish with freshly grated Parmesan cheese and additional pine nuts if desired. Serve warm or at room temperature. Mixed salad with olives. Ingredients: mixed green leaves, for example rocket, spinach, lamb's lettuce, Kalamata olives, pitted, cherry tomatoes, halved, cucumber, sliced, feta cheese, diced, optional, balsamic dressing. Directions: arrange the mixed green leaves on a serving plate. Olives, cherry tomatoes, cucumber and feta cheese on top. Drizzle with balsamic dressing. Serve the whole grain pasta with pesto, cherry tomatoes and rocket on a plate, garnished with fresh Parmesan. Serve with a mixed salad with olives as a refreshing side dish. This dish is not only delicious, but also full of nutrients and healthy ingredients. Dinner: zucchini soup with vegetables, grilled chicken drumsticks, steamed vegetables, zucchini soup with vegetables. Ingredients: for the zucchini soup, 4 zucchini, washed and diced, 1 onion, chopped, 2 garlic cloves, chopped, 1 potato, peeled and diced, 1 carrot, washed and diced, 1 liter of vegetable broth, 1 teaspoon olive oil, salt and pepper to taste, fresh herbs, for example parsley or chives, for garnishing. For the grilled chicken drumsticks, 4 chicken drumsticks, 2 tablespoons olive oil, 1 teaspoon paprika powder, 1 teaspoon garlic powder, salt and pepper to taste. For the steamed vegetables, vegetables of your choice, for example broccoli, carrots, sugar snap peas, 2 tablespoons olive oil, juice of 1 lemon, salt and pepper to taste. Directions: zucchini soup. Heat the olive oil in a large saucepan and fry the onion and garlic until soft. Add zucchini, potato and carrot. Fry briefly. Add the vegetable stock and bring to a boil. Reduce the heat and simmer the soup until the vegetables are soft. Puree the soup until it has a creamy consistency. Season with salt and pepper. Garnish with fresh herbs. Grilled chicken drumsticks. Marinate the chicken thighs with olive oil, paprika powder, garlic powder, salt and pepper. Grill the marinated chicken thighs on the grill or in the oven over medium heat until cooked through and nice and crispy. Steamed vegetables. Prepare the vegetables of your choice and cut them into bite-sized pieces. Heat the olive oil in a pan. Add the vegetables and fry briefly. Drizzle the lemon juice over the vegetables and sauté over medium heat until tender. Season with salt and pepper. Serve the zucchini soup in bowls, garnished with fresh herbs. Arrange the grilled chicken drumsticks and steamed vegetables on separate plates. This menu offers a balanced combination of a delicious soup, crispy chicken and fresh vegetables. 1 week cooking plan: fast cooking. Breakfast, lunch, dinner. For 2 people. Here is an example of a recipe plan for a low histamine diet for 1 week. Note that the tolerance of foods can vary from individual to individual, so it is advisable to adapt to your own needs and possibly replace foods that are better tolerated. Monday. Breakfast. Freshly squeezed juice from green apples, carrots and ginger. Gluten-free muesli with almond milk. Lunch. Grilled chicken with quinoa. Steamed spinach with garlic. Dinner. Grilled salmon with lemon dill sauce. Oven-baked sweet potatoes. Cooked green beans. Tuesday. Breakfast. Smoothie with frozen berries, banana and rice milk. Lunch. Vegetable soup with carrots, celery and zucchini. Rice noodles. Dinner. Beef and vegetable pan with broccoli and peppers. Quinoa as a side dish. Wednesday. Breakfast. Oatmeal with fresh strawberries and honey. Lunch. Lemon herb chicken salad with arugula and avocado. Dinner. Baked chicken breast with rosemary. Oven-baked vegetables. Tomatoes. Zucchini. Eggplant. Thursday. Breakfast. Avocado smoothie with spinach and cucumber. Lunch. Fish fillet. For example cod, with tomato herb salsa. Quinoa as a side dish. Dinner. Lentil soup with carrots and leeks. Gluten-free bread. Friday. Breakfast. Fresh fruit salad with mint. Lunch. Grilled vegetables. Peppers. Zucchini. Eggplant. With lamb chops. Dinner. Scrambled eggs with fresh herbs and tomatoes. Gluten-free bread. Saturday. Breakfast. Buckwheat pancakes with maple syrup and fresh strawberries. Lunch. Tomato basil chicken salad. Dinner. Tuna steak with sesame crust. Steamed broccoli. Sunday. Breakfast. Smoothie bowl with banana, kiwi and coconut flakes. Lunch. Stuffed peppers with minced meat and rice. Dinner. Grilled chicken legs with rosemary potatoes. Cucumber salad with dill. Be sure to drink enough water and keep an eye on your individual tolerance range. If you are unsure or have more serious health problems, it is advisable to consult a doctor or nutritionist. Attachment. Histamine. A biogenic amine that occurs in the human body and is naturally present in many foods, may cause adverse reactions in people with histamine intolerance. Histamine intolerance. A disorder in which the body has difficulty breaking down histamine, which can lead to symptoms such as headaches, rashes, and gastrointestinal upset. Histamine liberators. Substances in foods that can stimulate the release of histamine from mast cells in the body. Biogenic amines. Naturally occurring compounds in foods such as histamine, tyramine and phenylethylamine, which can cause histamine-like reactions in some people. Diamine oxidase. An enzyme responsible for the breakdown of histamine in the body. In cases of histamine intolerance, a lack of DAO can lead to poor histamine processing. Low histamine diet. A diet that avoids foods high in histamine to minimize the symptoms of histamine intolerance. Elimination diet. A diet in which certain foods are temporarily removed from the diet to test whether they cause symptoms. FODMAPs. A group of fermentable carbohydrates found in some foods that can cause gastrointestinal discomfort in some people. Leaky gut syndrome. A theory that suggests that a disrupted intestinal barrier can allow undigested particles to enter the bloodstream and contribute to health problems. Food allergy. An immediate reaction of the immune system to certain proteins in food. Food intolerance. A delayed response of the digestive system to certain foods, which can cause symptoms such as abdominal pain and bloating. Rights and ownership notice. This audiobook is published and distributed by Testbericht-Institut LLC. All copyrights, publishing rights, distribution rights, audio rights, and related intellectual property rights for this work have been lawfully and exclusively acquired by Testbericht-Institut LLC. Testbericht-Institut LLC is the sole and unrestricted rights holder of this audiobook, including the right to reproduce, distribute, publish, monetize, and publicly perform the content on digital platforms such as YouTube. The original manuscript files, source documents, and contractual acquisition records serve as proof of lawful ownership. The original author and/or their authorized representative, Renovatio LLC, has transferred all relevant rights to Testberichtinstitut LLC in accordance with applicable copyright and publishing law. This ownership applies to all current and future uses of this work, including audio, video, and digital publications. Effective date of rights ownership: the 1st of February 2026. Any unauthorized use, reproduction, re-upload, redistribution, or claiming of this content is strictly prohibited. Copyright Testberichtinstitut LLC. All rights reserved.